I think one of the hardest things that we have to look at today is the concept of returning to sport. A lot of times when we're looking at athletes, when we're looking at whether it's rec league, professionals, one of the things that we get caught up in is how fast these guys get back into their sport, right? You have certain athletes that take almost a year. You take the Klay Thompsons, right? Multiple injuries that eventually led him to come back and win an NBA championship, which is a fantastic story. But the number of hours and dedication that he had to put in to get into that is something that is really, really hard to attain. What we do in the PT world is we have to figure out, first of all, what's the baseline that our patient is coming to us with, and what can we do to make sure that we get them not just to be a better athlete, but to perform at a higher level, to make sure that this injury potentially does not happen again as best as we can. And so the process is a little difficult. It's a little convoluted. There's a point where you have to hold the person back. There's a protective phase. And after that protective phase of getting them back and getting some strength and some mobility, depending on the injury that they have, then there's a what we call like a regenerative phase, where we really focus on trying to get them bigger, faster, stronger. And that's not something that's really easy to do. It takes many, many years to perfect that skill set to know how to push an athlete the right way. And here at the Center for Advanced Orthopedics, that's exactly what we have. We have therapists who have dedicated years themselves, many of them being former athletes, who've now come around that gamut to come around and say, all right, I want to help you as an athlete get back onto your feet. And so it's not as simple as, hey, you're 8 weeks post-op or you're 6 months post-op and you're ready to go back. It's like, no, we got to teach you how to crawl again, right? Then how to walk again, and then how to run. And then, it's a slow progress. And so I think a lot of times what we find in the world of rehab is that people forget that patience is key. People forget that it takes a team approach to get that back. And so here at the Center for Advanced Orthopedics, we work directly with our physician counterparts to make sure that us as therapists are at the top of our game, to make sure that we're able to get patients back on track as quickly as possible. One of the hardest things to do is to determine, one, what type of athlete are you, right? We have athletes that are as young as 5, 6, 7 years old. You have your collegiate athlete, you have your weekend warrior, you have your professional athlete. And with each one of those realms comes a different level of injury, a capacity for injury that's different. And so when it comes down to looking at who those people are and meeting them at their level, sometimes we have to work on preventative care, and sometimes it's trying to make sure that we can help someone who has got a minor injury through the season to make sure that they're not going to make it worse. But in many cases, when we're talking about return to sport, it's not just holding them back, it's trying to make sure that we're not letting them get injured again. And so finding the right strengthening ideas, finding the right mobility techniques to kind of make sure that they're actually performing at a higher level is very, very key. And it's hard nowadays, right? Nowadays, everyone wants to get back to sport as quickly as possible. And that's one of the most difficult things for us to do, is make sure that we tell them, like, this is what the science shows us. The science shows us very clearly that you got to hold at this phase, you got to push at this phase, you got to return at this phase. And if we can work well with the athletes and work well with their families and their communities, we can make sure that 9-year-old doesn't get hurt again, and we can make sure that Olympian or Paralympian gets back to playing sports again as well. So one of the most unique things here at the Center for Advanced Orthopedics is that us as physical therapists, we have direct access to everything. Instead of waiting 2 or 3 weeks to have some type of communication with an outside orthopedic surgeon or a primary care physician, for us here it's simple. We have a direct communication system in-house. I can send a direct message to any one of our doctors and they'll message me back immediately. We can solve the problem for the patient in live time. And in many cases, usually it's within 24 hours. And that leads us to get better productivity and better outcomes for our patients. I mean, one of the most difficult things to do in the outpatient world today is you have a lot of these box gyms or all these therapy clinics that, swear up and down that they have the sports athletes and they have these little gimmicks here and there to sell it. Well, we don't have gimmicks here. We have hardworking people that are ready to kind of get you back to working by creating a collaborative team. There's the physicians in bucket A, and there's the PT in bucket A1, and there are the MAs in bucket A2, and we all work together as a collaborative team to make sure that you have A+ quality work given to you to get you back as fast as possible. And that's something that's very, very unique to the Center for Advanced Orthopedics. You won't find that anywhere else. And that's one of the reasons we're one of the top performing orthopedic groups in the nation, right? We work together for you.